Okay, this is a great question, and I actually looked into this a bunch, and it's kind of hard. This is like a gray area for nurses, right? As nurses, we are not allowed to make diagnoses. So if you're giving any information and it's going to be diagnostic information, then I might be a little hesitant to relay that to a patient or their family member. That is something that a doctor should do. Now, with the COVID surges and everything, the hospitals have been really, really, really busy. And I feel like this has gotten even more gray. So definitely check with your facility on what they allow nurses to relay to patients and their family members. For me personally, at the hospital I'm at, and the ICU that I'm at, the hospital has an electronic medical record that patients and their family members can access. So as I'm getting lab results, as I'm getting radiology results and all those things, the family members can see them at the same time. So I am not telling them anything that they don't already have access to. So for example, if the patient got a daily chest x-ray, and it's I will give the family member the results as far as the report reading that's already been interpreted by a physician. If there needs to be further interpretation of these results, that's when I would defer that to physician. I would say hey, I'd just be straight up front. They ask me, hey, what are the x-ray results? I say, I can read the report to you from the radiologist. However, as far as interpreting these results, that has to be done by a physician. So, I could read the report to them. Now, if it was going to be something that was going to lead to more questions, like if a patient had a CT scan and it's showing that they have METs in their brain or something like that, well, then I might just defer that to the physician. Just say, hey, I'm still waiting for those results. The physician can interpret them for you. Things like daily labs and whatnot, I don't really have a problem relaying that information because those are being done daily and we're kind of trending those things. Family members are asking about, hey, what is their white blood cell count? Hey, what is the hemoglobin? Hey, what is their kidney function today? And so as a nurse, we have a basic understanding of lab results and can interpret that, but we're not actually diagnosing them with hey, they're in kidney failure or things like that. That needs to be done by a physician. So I hope this sort of clears things up. It's kind of difficult. Basically, don't make diagnoses as nurses. You should be able to relay some basic information to patients and their family members. Most hospitals have an electronic system where they can access the same information as you. So as long as you're not interpreting those results in a diagnostic form, you should be okay.